Bill John Baker.
Here.
Jack Baker.
Here.
Harley Buzzard.
Here.
Julia Coates. Here. Joe Crittenden. Jody Fishinghawk. Meredith Fraley. Here. Don Garvin.
Honey.
China Glory Jordan.
Present.
Curtis Snell.
Here.
Chris Stowe.
Here.
David Thornton. Kara Cowan Watts. We do have a quorum.
Next, I will seek approval of the July 13th, 2010 regular session minutes.
Second.
Have a first and second. All those in favor say aye.
Aye.
Any opposed? Approved as written. Next were 2 reports from the Claremore Service Unit is George Valaire, and I see he is not here, but he sent his Jack Lord-ish Hawaii 5-0 really cool blue blazer guy here. No, I'm kidding. You are the next contestant.
Committee member, Mr. Vallier went to out of state to a meeting, so I'm pleased to be here. And you have this June report in front of you, although we're a little later than that, but some of this is contemporary and statistical is June. The accomplishments from that month, we have been doing quite a few site visits in the OB-GYN and ER physician arena and also internal medicine. And I've actually made some selections. They haven't accepted as of yet, but I do have one new podiatrist that we brought in who was a IHS scholarship obligee, and that brings us up to 2. And then I also hired a emergency room physician that's well experienced, and her name is Dr. Harbin Nelson. And I'm sorry, the podiatrist is Carl Miller, and he is in partnership with Dr. Lashley. We are using a private search firm, recruiter firm out of Missouri, and I've been working with her as far as referrals, and I continue to get referrals, so I'm optimistic that we'll be bringing on some more physicians shortly. The outpatient visits are 14% above last year in June. Revenues increased, as you can see, 3.8%. And the roof project now is getting very close, over 80% completion, and that, I'll remind you, was from stimulus money. The MRI is approved. It's not been located as of yet. And then the ER remodel, as you know, we've had a hiatus with the architect to get that going, and that project is going to restart. And I'll remind you, that's where we're flipping the front and the back of the ER for security reasons and patient flow reasons. Now the front of the ER will be at the back door rather than in the middle of the ER. Workload is up 14% with 21,000 visits in June. Admissions, that's a perennial fall in the census in the summertime, and that's down 26% admission with an occupancy rate of 19%. The newborns are steady at 23. You'll see that we've got quite an increase in reactivations and new charts. We're picking up over, well, as you can see there, that's almost 500 for June. And a lot of people are losing health insurance and coming back, so I'm proud to say we're a safety net for quite a lot of the population in Oklahoma. The third-party collections for June, actually, the collections were almost $1,996,000, and the bill for June was $1.98 million. Year-to-date collection $9.4 million, and the increases compared to 2009 are 345,000, and we're out 3% on our receivables over 120 days. And I attribute a lot of that to the electronic health record. Now we tend to run only 1 to 2% on our backlog on as far as charting, where before we were up in, when we were on paper, it was up around 40%. So that's quite an improvement utilizing the electronic health record. Contract health, we had, as you can see, over almost 1,200 denials for worth about 6.7 million, unmet needs 2,200 for value of 2 million. Up year to date, June, 572 cases of denials at 918,000, unmet needs 3,000. Appeals 40, and the committee went through 1,300 files for the month of June. I will say since then we've been getting some more money for contract health out of Oklahoma City, which has really made has been a really big help and made a dent, I think, in the unmet needs you'll see in the future. Can I answer any questions?
Any questions?
The contract health that has been denied, the applications coming has been denied, will they be looked at again in the future when you get more monies?
I believe only the unmet needs are looked at again, and I assume those have probably already been funded. Someone that's been denied, they go through the appeal process, and then also they can, if they feel their condition has worsened, then they can get another referral, and it would be looked at again.
But if they've been denied, say 2 or 3 times, do you keep refiling?
If they've been denied several times, it's probably because it's not a life and limb threatening condition. It's probably a chronic condition. So that's
Well, this particular case I'm talking about, they went to Claremore Indian Hospital and they checked them out one day and they, said you're fine. 2 days later, the little lady had a liver attack or something on the job and just fell over. So they had to take her immediately, and have surgery. Then contract health wouldn't know.
Well, I hope she appealed that.
She did.
Okay. And it wasn't overturned.
As far as I know, it was denied again. But I think she appealed it one more time. But I don't know where it's at today.
After it's appealed to Claremore, then it would be appealed to Oklahoma City, and then actually even Rockville is the ultimate appeal.
Okay.
And they have overturned as high as Rockville. So I would definitely recommend on a call-in like that. I'm not aware of the circumstances.
Right. Okay, thank you.
Councilor Soder.
Thank you, Mr. Chairman. I've been requested to deliver a letter of appreciation to Claremore and the Cherokee Nation Health Departments, and would like to request permission to do that, to deliver that. I think that this is a sincere letter of appreciation, and it's really indicative, I think, of what people do and in our health clinics and why they do that type of work is to get letters like this. So I would just like to ask that you share this with the individuals and that we're involved, and then just let George know that we do appreciate the work that goes on there at Claremore, and then Melissa as well. I think there's some reference there to the health clinic there at Salina, so I just wanted to deliver that.
Thank you. Any other questions?
Councilor Buzzard.
I had a question. I don't know about the MRI. You may not know the answer today, but how many MRIs do you usually send out from the Claremont Hospital?
I couldn't give you an absolute number, but compared to CTs, it's a very small number. A lot of times we can determine from a CT, especially our new CTs, what we need. However, when it gets into soft tissue like brain and knees and things with a lot of muscle involved, MR is better. But percentage-wise, it is an expensive test, but there is what I would call a niche for it, but we rarely use it in emergencies. CT is usually the way to go in emergency situations.
Just one more question on, I didn't write it down. Now, let's see, I was going to talk about dialysis patients. Does the Indian Health Service have a dialysis station that they use, or is it all contracted out to Claremore?
Excuse me, I didn't understand.
On a diabetic person, they use the dialysis machines. Do you contract that all out, or do we?
Yes, we cover dialysis until they're on Medicare, and usually that's about 6 months. Now, we also refer to nephrology to see if they need dialysis, and then we cover it until.
But it's on contract is what I'm asking. Each contract.
Contract health service is what we use. We don't have a contract with any.
I see. Okay.
We don't send them straight to dialysis.
Okay.
Just through contract health.
Okay. Thank you. Thanks, David.
Any more questions for Claremore Service Unit? That's it. Thank you very much. Next, Cherokee Nation Health Services. Melissa, you are the next contestant.
Thank you. Good morning, everyone.
Good morning.
First, I just want to thank Meredith and Chris for the letter that they gave us. It's very nice. We don't often get letters. I think people in general, including myself, usually only write letters when you have a complaint. So it's nice to get a letter of appreciation. So appreciate them giving that to us, and I'll be sure to share that with all the staff. It's very nice. You got a copy of my report in your packet, and hopefully you've been able to review that, and if there are any questions, I'll be glad to answer those.
Do we have any questions for Cherokee Nation Health Services?
Yeah.
All right.
Not a question, more or less a statement. I was watching the news here about 2 weeks ago, and they come up and said that diabetes is the #1 killer in the United States now. So we still need the dialysis machine down there around South. So.
Well, we're a lot closer.
You know, I didn't realize that when we did it. You know, they were saying it
Yeah.
causes heart attacks, it causes kidney failure, just all kinds of problems, and it's the #1 killer in the United States. You know. And they said that it's going to break the health department, said there'll do something about it. That's what I came across
Couldn't
as
agree
far as
more.
the government.
That's why we have a lot of prevention programs going on, and diabetes prevention programs that are very successful.
Thank you.
I think that, just to comment, I think my externships and residencies were in diabetic retinopathy, and I think it's interesting. Most people don't know on the medical side of it what we do eye-wise, but just from a practical seeing standpoint, I cannot make a pair of glasses unless their A1C is below 7, not even close, and that sometimes takes 6 and 7 months.
Which is our goal
Yeah.
for our diabetics.
Any more questions? Yeah, Councilor Bozer.
Melissa, I noticed that you didn't do, or they didn't, or whoever did the report didn't do a third-party collections on clinic visits there, and I'm still interested in it.
They didn't what?
I don't see a chart in here for the third-party collections per clinic. And, you know, I'd asked for about the J clinic in comparison with the clinic over in Salina, because the patient load is about the same, and we were $500,000 to $600,000 less. And the reason I guess I'd like to see this stuff, because the community people in J and Delaware County, they really want a new clinic, and it's important that we do that third-party collections. And if we've got people hard to make sure that we collect those insurances, then they need to be doing their job. Because I've run a new clinic for people in the Delaware district up there, and that's important because I know what third-party collection does. It builds clinics for us, so I'd like to, whoever
Well, I
does over
couldn't agree
forward-
more, and I apologize for it
Yeah.
not being in there. I thought
Okay.
after you requested that the first time, I had instructed them to put that
And
in
they
there.
were really good about it. This
They
didn't
just
show up.
They've just inadvertently left
Yeah.
it out this month.
Okay.
So I apologize for that, and I'll remind them
Well, that's fine, you know.
to do
I just want to bring it to your
that. And
attention.
just on your other point,
Uh-huh.
we have been focusing on that, and we have an action plan, and I think we'll start seeing a difference.
Good. Well, thank you. Good. Thank you. And I realize, you know, that third-party collection does a lot for our health services, and I think we all need to be aware of what it does for us. And I'm really proud of the health department, what they've done in the past. Because you look at the clinic that's been built, along with the dental clinic that you started over in Salina, you know, those things are important for us. So anyway, you're aware of it, and I just remind you. Thank you.
Any more
Thank you.
questions? I think you're out. Next, we're to old business. There's none pending. New business, there is a resolution on the agenda. I'm going to hand that off to Councilor Fulbright.
Okay, thank you. Basically, this is, well, I'll read part of it here. It says, the health group is in need of funding to meet new and pending requirements under the American Recovery and Reinvestment Act, the Patient Protection and Affordability Act, and the pending implementation of ICD-10. Be it resolved by the Cherokee Nation that the Cherokee Nation Tribal Council hereby authorizes the proposal to be prepared and submitted to the Indian Health Service in the amount of $300,000 to train staff and meet regulatory requirements. Be it further resolved by the Cherokee Nation that the principal chief or his designee shall be authorized to conduct negotiations and execute all official documents in this regard. And I recommend its passage.
Second.
We have a first and a second. Is there any discussion on this resolution? All those in favor say aye.
Aye.
Are there any opposed? Resolution passes. Next, we're to announcements. I do have one other than the next meeting. Much like Councilor Buzzard in community service, I have the budgets for health, and I will pass those out so you can have those going into budget. And I know some of you will review those. And other than that, the next meeting is scheduled for Tuesday, September 14th at 11 a.m. Are there any other announcements? I will seek a motion for adjournment.
Make a motion to adjourn.
First and second, all those in favor say aye. Aye. All those opposed, we are adjourned.